Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for reflux in infants. So I'm talking about spitting up in children who are under age 1. Spitting up is extremely common in infants and usually resolves by 1 year of age. Tip number 1 is look out for warning signs. If your child is spitting up, look out for signs like them being really fussy and upset around eating time and after spitting up, refusing to eat because of spitting up, arching their neck and their back while they're spitting up blood, choking, their vomit being forceful or projectile, them having frequent coughing, failing to gain weight appropriately, and recurrent pneumonia. All of these are signs that maybe your child spitting up is a more serious problem than just normal spitting up of infancy. Tip number 2 is tell your doctor about any concerns you have about spitting up. In most cases, a thorough history and physical exam is all that's needed to be sure that spitting up is not a serious problem. And all parents usually need is some education and reassurance that spitting up is very common and will resolve. Tip number 3. There are measures you can take to avoid spitting up in children or reduce the problem of spitting up. The first tip I'm giving you for this is avoiding exposure to tobacco smoke. Make sure that no one smokes around your child, and try to limit people who smoke at all from contact with your child. So even if they smoke outside of the house, they can bring smoke in on their clothes, and this can make reflux worse. Tip number 4 is burping your infant frequently during feeding. This can help reduce reflux. Tip number 5 is avoid overfeeding with your child. If your infant is not interested in feeding anymore, then let her stop. Overfeeding can make reflux worse. Tip number 6 is after feeding, keep your child calm and upright. This is best done by keeping your child on your shoulder for 20 to 30 minutes. Not placing your child in an infant's seat, which doesn't give your child enough upright angle and often will be more upsetting than resting on their parents' or care provider's chest. Tip number 7 is thickening of feeds. Now, women who breastfeed should not stop breastfeeding because breastfeeding has been shown to reduce reflux. But women who pump their milk and women who use formula could try thickening feeds. To thicken feeds, add 1 tablespoon of rice cereal to 2 ounces of formula or pumped breast milk. And thickening feeds have been shown in some studies to reduce the risk of reflux. Tip number 8. Switching to milk and soy-free formula. Switching to milk-free and soy-free formula, or changing the mother's diet to eliminate milk. In some cases of reflux, after you've tried all of the measures I've described above, symptoms continue. This could be a sign that your child has a dietary protein enteropathy, which means basically an allergic reaction to cow's milk protein that can be found, or soy milk protein found in formula or breast milk. So it is useful in cases that have not responded to all the conservative measures I've described above to try your child on eliminating cow's milk proteins from the diet for mothers who breastfeed. So basically avoiding milk and milk products for a short time period to see if this improves symptoms in women who breastfeed. Or for women who use formula, trying semi-elemental formula, or restricting milk from, trying such as Elecare, which is a type of formula that does not have milk protein or soy protein. You should ask your doctor about the specifics of which semi-elemental formula would be right for your child. Tip number 9, if all of the above measures have failed, your doctor may consider trying a proton pump inhibitor for your child. A good example of this is omeprazole, or Prilosec, which can be given 30 minutes before the first feeding of the day. And it has been shown in some cases to reduce the irritability associated with reflux. And tip number 10 is to believe in yourself. With cooperation from your pediatrician or family care doctor, addressing reflux, improving symptoms, and helping your child with this problem are easily manageable with these steps. I hope this video has helped. Thank you very much and have a great day.